A very good morning, guys. So today we are going to have a discussion on paranasal air sinuses, right? Okay. So I'm sure you're very much well known about the clinical case which is related to the paranasal air sinuses. It's a familiar term for you. So let us begin with the case. Right. So let me read out the case for you, and we'll mark the important phrases in this case, right? Okay. A 56-year-old male came to the OPD outpatient department with the complaints of headache and pain in the cheek, right? It was for the past 10 days, and this pain is aggravated by coughing and on bending the head. On examination, the anterior rhinoscopy showed pus in the middle meatus. Okay, so there was pus in the middle meatus. And also, the turbinates and mucosa over the middle meatus was appearing red and swollen, right? Okay, so as you read through this case, I'm sure most of you might be very confused with this because you have a lot of new terms here. Okay, something that will be familiar for you is headache. There is pain in the cheek, and it was increasing when the person was coughing and was bending the head, right? Okay, this is actually a case of acute maxillary sinusitis. Okay, so this is a case of acute maxillary sinusitis. Let me simplify this term for you. Acute because this has happened only for the past 10 days, so we can call it acute. And it is sinusitis. We know itis means some inflammation, so it is the inflammation of sinus, right? And maxillary, there are about 4 different types of sinuses in the head. Okay, so out of the 4, it is the maxillary sinus which has been inflamed, right? So we call it acute maxillary sinusitis. So still you might be little confused with this. So let us see those new terms for you. Now in this case, let me mark the new terms. We do not know what is middle meatus, right? So we do not know what is middle meatus. We do not know what is turbinates, right? So these are 2 important words we do not know. And anterior rhinoscopy. Okay. So the today's session is going to be about elaborating the paranasal air sinuses, and in that we will talk about this middle meatus and turbinates and all. Okay. So obviously many of you might have heard about sinusitis. It is a very painful condition. Maybe, you know, it's not a rare case. Okay, so some of you might have personally experienced it. Okay, right. So before getting into the session, let us have a preview. So we are going to start with nasal cavity. Okay, so I'm going to give you a little orientation of the nose, the external nose, the nasal cavity. Then we are going to have a quick review about the ethmoid bone osteology. Then we will see in detail the paranasal air sinuses, a bit of radiology, and finally we'll see what's important for your exams. Okay, right. So let's start with this. First, nasal cavity. Okay. So we all know nose is something that is located on the face and that you can palpate, right? Yes. But actually, anatomically speaking, nose has 2 parts, right? What are the 2 parts? We have an external nose, that which we can see and palpate. And there's another part which is called the nasal cavity. Okay, the nasal cavity proper. Where is it located? As you go inside the nasal aperture, you will reach the nasal cavity. And next to the nasal cavity, posteriorly we have pharynx. Okay, and posteriorly we are having pharynx. Then continued by that we have larynx, then trachea, and then it will end up in bronchi, bronchioles, and of course the lungs. So you can see this well in this diagram. So basically, nasal cavity has two components. One is the external part, the nose, the external nose, which includes the vestibule. Okay, vestibule is actually this cartilaginous flexible part. Okay, and the nasal cavity proper. So what you're seeing here in blue color, I'm highlighting that for you. That is the nasal cavity, right? Okay, right. So this nasal cavity, how many nasal cavities do we have? We have got two nasal cavities, right? But commonly we used to refer the entire both the nasal cavities together as a single nasal cavity. But anatomically, technically, we have two nasal cavities. The left nasal aperture opens into the left nasal cavity, and right opens into the right nasal cavity. And how is this right and the left nasal cavity been separated? This has been separated by the median nasal septum. Okay, right. We'll see all those details shortly. Okay. And one more thing. So anteriorly, it is starting by the nasal apertures. From here, it goes back, enters the nasal cavity, and then posteriorly, the nasal cavity ends up in a structure called choanae, right? So this is actually an opening. Okay, it is an opening in the bony part through which the nasal cavity will communicate with the nasopharynx. Okay, and as I said, from nasopharynx, it goes to oropharynx, and then comes down to the larynx, and then it goes to trachea, and eventually the lungs, right? And in the external nose, we have some basic parts, right? We have the root of nose, we have the dorsum of nose, and then the tip is the apex of nose. We have the alar part of nose here on the lateral aspect. Then in the middle, okay, the depression of or the descending part of the apex is called as the columella, okay, the median columella. And the alar part and this median columella together form the nasal apertures or nares. Okay. Right. So before talking about these anatomical structures which are present in the nose, let me familiarize to you some physiological functions. Okay. So if you know the functions, it is more easier for you to retain the anatomical structures, right? So what you're seeing right now in your front is the function list of functions. So nasal cavity, just bring your common sense. What is happening in the nasal cavity? The air is flowing, and this air enters through the nares. Okay, when we breathe in, the nares are the apertures through which the air enters. Then it goes to the nasal cavity, and in the nasal cavity, something happens to this air. Okay, and then it goes to the pharynx, larynx, and trachea. Okay, know one thing: the air that is present in the atmosphere is not exactly the same as the air that enters the lungs. Okay, there is some change has been occurring to the air in the nasal cavity. Okay, so this change is listed out as the functions. So the first function is something we know, respiration, because through the nasal cavity only the air is able to enter the lungs. So first function is respiration. And then the second function is humidification of air. What is humidification? Adding moisture to air is called humidification, right? So that is also a function performed in the nasal cavity. And how can this humidification occur? Humidification is simply adding moisture. So moisture is added when there is some serous or mucino-serous secretion in the nasal cavity. So what secretes such things? The nasal epithelium, okay, the lining epithelium. The lining epithelium will be helping in the secretion, and this secretion will add moisture to the air. That's how humidification occurs. And the other function is filtration. We all know the air that we breathe in, obviously it's not pure. So it has foreign bodies like dust particles or microorganisms. So that has to be filtered before it reaches the lungs. So how is filtration performed? Mainly in the nasal cavity, it is by means of two important structures. One is, we know there are hairy, of course, obviously these are hair in the external part of the nose, right? In the vestibule, on the interior aspect, we have hairy structures. Now, what are those hair called as? Okay, we call those hair as vibrissae. Okay, the hair that is found in the external nose on the interior aspect of the nasal vestibule is called vibrissae, right? Okay. So that is one structure which helps in filtration. The other structure which helps in filtration is the mucous secretion. We all know when there is some foreign body entering the nose, the mucous secretions will enclose the foreign body, and then it helps in the removal of the foreign body. So it's again by mucus. So how is this mucous secretion occurring? Again, as I mentioned you, it is by a specialized epithelium. Okay. So this is another function. And the most important special function is olfaction. What's olfaction? You all know, obviously, this is smelling. When air enters inside, if there is smell or a specific aroma to the air, that is sensed by your nose, right? So where is this function happening? It is in the nasal cavity, okay, especially on the top portion, the roof of the nasal cavity, where we have olfactory nerve endings. So these are also another important function, okay? And the last and the most important function is slowing down the speed of air, okay? So as we mentioned, humidification, filtration, olfaction, these are not things that just happen in an instant, right? They need some time, okay? So the air that enters inside has to be slowed down so that the functions like humidification, filtration, and olfaction can occur, okay? So what structure does this function of slowing down the speed of air? We have something called turbinates, okay? I'll show that for you in the diagram. We have something called turbinates. So the name itself implies that its function is to slow down the flow of air, right? So as we are now familiarized with the purpose of the nasal cavity, we know certain parts in the nasal cavity, and we'll see that in detail, okay? Right now, what you're seeing in the screen is the nasal cavity. We have isolated it outside, and we are going to deal only about the nasal cavity here. So it has been shown as three regions here. What are the three regions? First, on the top, I mentioned you, olfaction is a function. So the olfactory nerve endings are on the top so that they are close to the brain. So the olfactory region is on the top. The respiratory region is the major part, okay, that is the huge blue area, okay. And finally, we have nasal vestibules. So in the vestibule, there is vibrissae or the hair. This helps in filtration. And the very important thing I want you to look into is turbinates. I mentioned turbinates, the ones which slow down the flow of air. So turbinates are the blade-like ones that you can see in this picture. Okay, see this, I'm highlighting in green now. This is a turbinate, this is a turbinate, and this is a turbinate, okay. Similarly, on the opposite side, on the other side, that is the other nasal cavity is also having turbinates. So we have three pairs of turbinates, right? Three in each nasal cavity. On left, we have three nasal turbinates, right, we have three nasal turbinates. The other name of turbinates is concha, okay. What is the meaning of concha? Concha means shell, okay. So concha means shell, right. So now you can appreciate this well in the diagram. This is a coronal section of the nose or the nasal cavity, right. So here is the superior concha, here is the middle concha, and down here is the inferior concha. I mentioned you, right, there are three pairs. So these are the three pairs, superior, middle, and the inferior concha. So what actually is this made of? Is it bone or is it a cartilage? These are bony structures, okay. These are like processes extending from the bone, okay, or the bone itself. So these are ultimately bony structures which are in the shape of a blade, okay, that will help in slowing down the speed of air, right. So now with respect to concha, we are going to see three other features or structures, right. So this is it. The space or the cavity between the concha is called as meatus, okay. So because we have three concha, we have three meatus. In between the superior and the middle concha, we have superior meatus. In between the middle concha and the inferior concha, we have the inferior meatus, right. This is in between the middle and the inferior concha, we have middle meatus, and below the inferior concha, we have inferior meatus. On the top, just know this term also. This is sphenoethmoidal recess. That is above the superior concha, we have a structure called sphenoethmoidal recess. What is the meaning? So, spheno indicates the sphenoid bone, it is a facial bone, and ethmoidal bone. Together, in between these two bones, we have a recess that's called as sphenoethmoidal recess. And down here, we have hard palate, right? You can just imagine yourself, you have a hard palate, right? What is palate? You all know it. Palate is the roof of the oral cavity and it is the floor of the nasal cavity. Okay, so here they have shown the hard palate. Okay, and we also know that the one which separates both the nasal cavities is called the median nasal septum. It's here. Okay. The lateral and the medial nasal wall will be dealt separately in a different video. So the details of that will not be appreciated now. Now I just want you to know the basic structures in those walls. Okay. So before that, as I said you, the nasal cavity, we have two nasal cavity, and I told that the floor is made of palate. Then the middle, on the medial aspect, we have the median nasal septum. So laterally, we have the lateral wall, and on the top, we have a very narrow roof. Okay. So let us see the parts. So when someone asks you the boundary, you should say these four. First, we have median nasal septum. Laterally, we have the lateral wall, and inferiorly, we have the floor, which is made of hard palate. Okay. And on the top, we have a narrow roof. Okay. So we'll see what are the ones which form these structures. So right now, what you're seeing is the median nasal septum. Okay. So first, let us know how this has been formed. This is actually a sagittal section. Okay, sagittal section means in the center we are putting a cut section, and that's what you're seeing here. Guys, can you clearly see on what I'm showing on the screen, and are you able to hear my voice? Okay, so this is the median nasal septum. We have made a sagittal section and we are seeing the median nasal septum. So to be very clear about it, it is the right side of someone's face and we have made a sagittal section including the median nasal septum. So know one thing, the median nasal septum has two components, the bony component and we have a soft component which is cartilaginous. Okay, so let us highlight that. We have this one, I'm highlighting that for you. Here is the septal cartilage. Okay, on the anterior aspect we have the septal cartilage, right? I've highlighted that in green color. This is the anterior part. Now what is the bony part? The bony part of the median nasal septum is formed of two bones. Okay, mainly two bones. Here I'm highlighting that. Okay, I'm highlighting the entire hard part of the median nasal septum, and then we'll see the parts or the bones constituting it. Okay, so this blue color highlighted area is the bony part of the median nasal septum. What are the bones constituting this? Two bones. On the superior aspect, we have the perpendicular plate of ethmoidal bone. See, these terms will be very new for you. So it's not at all a problem. Because these bones are new for you, it will be different, but just know these names and give more concentration when you're listening to these new terms. Okay, right. So first, on the top, we have the perpendicular plate of ethmoid bone. Ethmoid bone has many parts. We'll discuss that in a couple of minutes. So just know that the perpendicular plate of the ethmoid bone is forming the top or the superior position of the bony part of the median nasal septum. Now the other bone on the inferior aspect is vomer. Okay, vomer is the other bone which is forming the bony part. Okay, so that's about the median nasal septum. Now let us see about the lateral wall. Okay, how are you going to get the lateral wall here? As I said, it's the sagittal section. You have the right side of the person and including the median nasal septum, right? So now let us break the median nasal septum. We'll take it off and then we'll go to the lateral wall of the right side nasal cavity. Okay. So you saw the vomer bone here, right? Just keep in mind. Now look at this diagram. In this diagram, the median nasal septum alone has been removed. Okay. So that we are seeing the right side or the right lateral wall. So here they are showing you the vomer bone. The pink colored one is vomer bone. If we would remove this vomer bone, you will see what you can see right now on the right side of the picture. Okay, right. So let us appreciate some parts here. I hope you remember this turbinates. Okay, I mentioned about turbinates. So turbinates are otherwise called as. So can you guys say what is the other name of turbinates? Okay, so we can see the turbinates in this. We have 3 pairs, right? So on each nasal cavity we have 3. The superior, middle and the inferior, right? So the superior and the middle are formed by the same bone. Okay, ethmoid bone is the one which forms the superior and the middle turbinates. Okay, and the inferior turbinate is an independent bone, right? Just keep that in mind. Superior, middle are forming are actually formed by the same bone, the ethmoidal bone, and the inferior is formed only by itself. It is a separate bone. Okay, so one more thing. So let us just appreciate the other feature. What is present in between 2 concha? Okay, very good guys, you've mentioned concha, right? So can you name what is present in between the concha, in between superior and the inferior? I mean superior and the middle concha, in between the middle and the inferior concha, and below the inferior concha. What are the structures? I mean, how do you name that particular region? Okay, so that is what I'm highlighting in green color. And on the superior most aspect, what we have is a special one called as, I hope you will remember that also. Can you name that? This pink color region which I'm highlighting, it is having a different name. I mentioned that there are 2 bones which are constituting the name. It's a rhesus. What rhesus is that? If you would say that, then that means you have a very good idea about the lateral wall now. Okay, so let us now move on to the next part of the nasal cavity. So in the next part, we have covered the lateral wall, we have covered the median nasal septum. Now we are going to see the roof. I'm sorry, the floor. Okay, we'll see about the floor. So in the floor, what is floor made of? Palate. Okay, we know there is hard palate and the soft palate. Anteriorly, the hard palate. Hard palate is also formed by 2 different bones. Okay, so what are the 2 different bones forming the hard palate? Okay, very good. So everyone has said it is sphenoethmoidal rhesus, right? Okay, now we are seeing the floor. Okay, what you're seeing in the middle that separates the right and the left is called the nasal crest. That's not important for us. We want to know the 2 bones which is forming the palate. Anteriorly, we have palatine process of maxilla. What is maxilla? It is the huge bone which is forming this anterior part. Okay, we'll see that in the skeleton in a short while. Just know this, the maxilla is this huge bone and that is giving rise to a process. Process means some projection. Okay, that projection is called palatine process. So the palatine process of maxilla forms the anterior part and the posterior part is formed by the horizontal plate of palatine bone. There is a bone interior in the inner aspect which is called palatine bone. It has 2 parts, horizontal part and the vertical part, which is otherwise called the perpendicular part. Of that, the horizontal part or the horizontal plate is what forms the posterior portion of the hard palate. Okay, now I just want you to know these names. That's enough for now. And here, what you are seeing in this diagram is the same lateral wall. Okay, it's the same lateral wall. Okay, so what difference are we seeing here? Before we saw only the skeletal structure. Now over that skeleton, something has been lined. What is it? The lining epithelium. Okay, the lining epithelium makes it look red or brown in color. Okay, so you can appreciate the same thing. I'm just highlighting it. You know, it is superior concha, this is middle concha, and this is the Inferior concha. Inferior concha is formed by an independent bone, right? In between the concha, we have the meatus. Okay, so concha, it's like, you know, in my nose, it is like extending just like this. There is superior concha like this, then there is inferior concha, and there is in between them there is a middle concha, right? So if you can see, there is recess present within the superior and the middle concha. Now, if you want to see the recess, you need to cut the concha. Okay, so we are going to cut a portion of the concha, and we are going to see the meatus, right? For us, the meatus is what is important. Okay. Okay, right. So in this picture, we have cut the concha to appreciate the meatus. Yes, meatus. Okay. Why meatuses are important? There in the meatus, we have some openings, okay, some special openings. And these openings are very, very important for you. It's a short note also. Okay. So here in the superior meatus, that is between the superior and the middle nasal concha, we have an opening of posterior ethmoidal cells. Okay. Okay. Just know that. Then in the middle meatus, we have a lot of openings. Okay. We have two parts first. Let me name the parts. You can see some, a huge bulge. Okay, this part, the green color highlighted one, this huge bulge is called as the bulla. And just inferior to the bulla, again I'm highlighting in green, we have some C shape or a curved shape depression. So that is called as the hiatus. Okay, the name is Semilunar Hiatus. So semilunar, you know, semilunar, half moon shaped hiatus is semilunar hiatus, and this one is the bulla, just superior to the hiatus. All right, so what are the structures opening into it? Okay, we'll see that. Okay, so you need to concentrate more now. This is very, very important. We have seen the opening in the superior meatus. It is the opening of posterior ethmoidal cells. And in the middle meatus, we are having opening of the anterior ethmoidal cells. Okay, anterior ethmoidal cells. And we have the opening of maxillary sinus, and we also have the opening of middle ethmoidal cells. Don't get worried about not understanding anything, because everything is new for you now. So we'll bring a correlation to all of these. Actually, these terms like ethmoidal cells, anterior, posterior ethmoidal cells, and the maxillary sinus, the frontal sinus, all of these are the paranasal air sinuses. Okay, we'll see that in detail. So just see where the openings are found. Okay, that's something important. Then on the topmost aspect, we have sphenoidal sinus. Okay, don't worry that you're not recollecting anything now, because we are going to see this paranasal sinus shortly. Okay, right. So now that you have a good orientation of the nasal cavities, we are going to have a look at the sinuses. Okay, paranasal sinuses. Okay, we have 4 different paranasal sinuses, and we can classify them into, we have 2 different classification for that. Okay, just by the name, we can classify them into 4 different paranasal sinus, or we can divide them into 2 groups. Okay, 2 groups based on where they're opening into. Okay, first of all, what is sinus? Let's bring it more simple. What is a sinus? Sinus is any closed cavity. Okay, closed cavity means it is some closed area. Okay, and this is lined by some epithelium. Okay, and this cavity might be filled with some fluid or with some air. Okay, and in this entire cavity which is closed, there will be one opening. Okay, just imagine, as I'm telling you, there will be one opening through which the fluid will drain out, okay, or it will communicate with an exterior surface, okay. So this sinus, we see them in two important places. In anatomy, we are seeing it as paranasal sinuses. In dermatology, we see that as sinus, which is a cyst gets converted into sinus when the opening is formed. Okay, that is not important for us, but just know it. Here in anatomy, we are seeing the sinuses in the bone. Okay, these cavities in anatomy, they are found in the bone, in the skull bone. Okay, in the facial bones and the skull bone, and they have one opening. So they are closed cavity, they have one opening, and all these, the openings, they form tubes, and through the tube the fluid will flow, and then they will drain into the nasal cavity. Okay, got it? Can you guys understand? There are cavities, closed cavities in the bone, and these closed cavities will have some fluid within, and that fluid will flow through an opening that will be like a tube, and that will finally drain into the nasal cavity. Okay, can you guys understand this? Are you able to imagine this? Okay, now we'll see those four different paranasal sinuses. Let me name that for you first, and then I'll show you in the diagram. Okay, so first we have the frontal sinus, then sphenoidal air sinus, maxillary air sinus, ethmoidal air sinus. Of all the four, the first three, frontal, sphenoidal and maxillary, are two in number. They are found as pairs, okay, one on the right side, one on the left side. But the ethmoidal air sinus alone is having three parts, okay, anterior, middle and posterior, or sometimes it is also referred to as just anterior and posterior. Okay, let us see that in the diagram. So first what you're seeing is the frontal air sinus in this diagram. I'm highlighting that in yellow color. You have two air sinus, frontal air sinuses, right? Second one, just below the frontal air sinus, we have ethmoidal air sinus. The green colored one is the ethmoidal air sinus. Okay, so these three form the ethmoidal air sinus. And then here the orange color is the sphenoidal air sinus, but see, it is not superficially found. The frontal, ethmoidal and maxillary, these are superficially or anteriorly found, but the sphenoidal is present deeper. You can appreciate that in the next diagram. Okay, look at here, this orange color, the right side, in the right side diagram we have an orange color, so you can see very well. So it's present very deep. Okay, it is the deeper air sinus, and below the sphenoidal air sinus we have maxillary air sinus. Okay, yeah, all right. So what is this frontal air sinus, what is this ethmoidal air sinus, what is sphenoidal, and what is maxillary air sinus? See, we are naming them based on the bone in which they are formed. Okay, so I said you, in anatomy the sinuses are those air cavities found within the bone. Okay, so let's get a better orientation. So have a look at this skull. Okay, so here we'll see where the sinuses are located. So first, the topmost is the frontal air sinus. So if it is frontal air sinus, it is found in the frontal bone. What is the frontal bone? This front portion, that is called the frontal bone, and you have frontal air sinus in this region. Then below the frontal air sinus, we have ethmoidal cells or ethmoidal air sinus. Why is it ethmoidal air sinus? It is present in the ethmoid bone. Okay, and below that we have the maxillary sinus. It is in the maxilla. Okay, it's like this. It's present in the maxilla. And as I mentioned you, sphenoidal air sinus is found deeper. I think this next diagram on the right side will give you a better orientation. The frontal sinus is shown very well there. See, the frontal bone, when you make a cut section, the sagittal cut section, you will see an air space within this bony lining, okay, between the outer table and the inner table. What is outer and inner table? That is the outer wall and the inner wall of the frontal bone, okay. So it's like just you're creating some cavity within this bone, right? So that's called frontal sinus. And coming deeper, we have sphenoidal sinus. So it is found in the sphenoidal bone, okay. Guys, can you understand now what is the sinus? Right. The other classification which I mentioned you is based on where they open into. We are dividing them into two groups as anterior group and the posterior group. Okay, so here is the division as anterior group and the posterior group. The anterior group is formed by three sinuses: the frontal sinus, the anterior and the middle ethmoidal sinus, and the maxillary air sinus. Okay, see, obviously, as you are seeing this in the first time, it will be very new to you. You need to revise this again and again. Then only you will come to know what is what, where is it present, and all. Okay, because the bone itself is new for you. These will be very new terms, so you don't have to get worried about that. Just listen to the names, and you can go through the things given in your book. And then, if you want, you can rewatch the session, so you will get a clear clarity about what is sinus, right? Now we will see about the relations of all these sinuses. So before seeing about the relations, we'll have a look at the actual sinuses in the skull. Okay. Right. Can you guys see the skull now? Just tell me so that I'll continue. So here, what are we seeing? A skull bone. We have frontal bone here. Okay, this one. I said there is frontal sinus. So this green highlighted portion is the frontal bone. Okay. So in the frontal bone, we have frontal sinus, right? Okay. So now we are seeing the left side of the skull. This is the right side of the skull. So we have zygomatic bone, maxilla and mandible. This is maxilla and this is mandible. On the left side, if you can see, I've removed the zygomatic bone. Okay, you can see some congested structure here, right? Because I've removed the zygomatic bone and the maxilla on the left side of the skull. Okay, so I'm now going to remove this mandible also, so that we can appreciate the other structures. Okay, so now I'll just show the point and you will have to say what is the structure. Okay, right. So where are we seeing right now? This is the lateral wall. Okay, this is the lateral wall that you're seeing now. And now you will tell me the names. Okay, so what did we see in the lateral wall? What are those structures we saw? Superior, middle and the inferior. That is what is shown here. Okay, this is the superior and the middle concha, and here this is inferior concha. If you can remember, I said inferior concha is an independent bone and superior concha is formed by a bone called ethmoid bone. Okay, we'll see the parts of ethmoid bone shortly. Just have a look at this now. And let us remove the concha. Okay, let us remove the concha, inferior, superior, middle concha, so that we will be able to see the medial nasal septum or the median nasal septum. Okay, so what are you seeing here? The one which I've highlighted is called the vomer bone. Okay, we said vomer forms the inferior part of the bony nasal septum. Okay, and as I've removed the ethmoid bone now, you will not be able to see that perpendicular part of the ethmoid bone. Okay, that perpendicular part will form the superior aspect of median nasal septum. Now let us see the floor of the nasal cavity. So I said it is formed by hard palate and soft palate. The hard palate, now we'll be able to see only on the right side because I've removed the maxilla on the left side. So if you can remember, I told it is palatine process of maxilla. Okay, so palatine process of maxilla forms the anterior part of the anterior 2/3 of the palate, hard palate. And here we have the palatine bone. Okay, I said there are two parts of palatine bone, the horizontal plate and the vertical plate. Here the horizontal plate of palatine bone forms the hard palate, the posterior 1/3, anterior 2/3, posterior 1/3. Okay. Now let us have a look at some parts of the ethmoid bone, because I think most of you do not know what exactly is the ethmoid bone. I'll just show the structures and parts of it. Okay, so for that I need to remove the parietal bone. Okay, parietal bone is this part of the skull. Okay, I'm removing the parietal bone and the occipital bone, right? So let us get into this. Okay, actually I've removed the ethmoid bone. So what you're seeing right now is the anterior cranial fossa. We have three cranial fossa, anterior, middle and the posterior. In the anterior cranial fossa, that's what we're seeing now. The bone that is highlighted now, the green colored one, is frontal bone. So here, this open area that you can see in the middle, you can follow my cursor. So that region is called as, there we would have a structure called cribriform plate. Okay, cribriform plate. Cribriform plate is actually a plate with fine openings in it. Okay, that is also a part of the ethmoidal bone. Okay, right. Okay, let's get back to the slides now. So I want you all to know a little bit about the ethmoid bone. Okay, see, basically we know some, and all those upper limb bones, they would be long bones. Okay, so long bones have some uniformity in their structure, but we also know that there are types of bones which are irregular in shape. You cannot appreciate them with uh, a single shape. They have complicated structure. So most of the bones in the skull, okay, the facial bones, not the skull bones are flat bones. The bones in the facial bones, okay, those constituting the facial bones are very complicated. They have a lot of structures in them. Okay, so if you need to appreciate it, there has to be a separate session for it. Okay, for now just I'm giving you an overview of what are the parts of sphenoid bone. The highlighted one, the yellow color highlighted one, is the sphenoid bone. So let's see the parts. Now we have been trying to break that into some segments so that the parts can be appreciated well. So look at here, this part which I'm highlighting now, I said cribriform plate. Okay, cribriform plate is the plate or the part of bone where you have many fine holes. If you can remember, I said you the olfactory region is in the roof of the nose or the nasal cavity. So there are fine nerve endings, olfactory nerve endings. They are communicating with the brain, okay, from the part of the brain to the nasal cavity. So the communication is by means of nerve fibers. And we have an olfactory bulb on the top in the anterior cranial fossa, and that bulb gives rise to some fibers, okay, nerve fibers. These nerve fibers will penetrate the bone. How do they penetrate? Through these holes in the cribriform plate, okay. So through that hole, the fibers enter down and then they enter the roof of the nasal cavity, okay. So the other structure you find here is crista galli. And what another thing is important is, if you can see, there are some translucent areas here, okay. These translucent areas are called as ethmoidal air cells or ethmoidal paranasal sinuses, okay. We have them on both the sides. And as I said you, there is anterior, middle and posterior, or we can also call it as anterior group and posterior group of ethmoidal air cells, okay. Now, I also mentioned you, the median nasal septum is formed by, on the superior aspect, it is formed by the perpendicular plate of ethmoid bone. So that's what I've highlighted. This is the perpendicular part of the ethmoid bone, okay. Right. So guys, know one thing, when you read some topic, because you are in the starting stage, everything will be new for you. So only when you correlate everything that you've learned, like in osteology, you will learn in detail about the ethmoid bone. So you will have to correlate that with the paranasal air sinus. Then you will learn something about respiration later in physiology. So when you learn that, you need to correlate that with the functions of the paranasal air sinus, because as I mentioned you, the moisturing function, that is humidification, all these are associated with respiration. There's a cause for everything that happens. So now when you listen all these things, it will be very new to you. You'll not be able to get a picture of what exactly is happening, right? So for now, just try to know everything, and then slowly you can correlate them with a lot of things in the time being, then everything will become clear for you. But for now, I'm trying my best to give you an idea about the other areas where the same topic will come, okay. So the four air sinuses have been listed here: frontal air sinus, sphenoidal, maxillary and ethmoidal. So we are right now seeing about the relations. I'm not going to answer this, you're going to tell me. I'm just going to say which side you need to look into. So how do you write relations? Based on the shape, we will say if there is any anterior relation, posterior relation, superior or inferior, okay. So for the frontal air sinus, anteriorly, what do we have? Frontal air sinus, you can see here in the picture, this orange color is the frontal air sinus. Anteriorly, anterior to the frontal air sinus, this is the region, okay. I'm highlighting that here, okay. That region in the skull is called superciliary ridge, okay, superciliary arch or ridge. And posteriorly, posterior to the frontal sinus, what do you have? Can you guys guess? I think most of you can answer. What do you think is present behind the frontal air sinus? Just see this picture which I'm showing you now. Follow my cursor, see this picture and just tell me, I've shown you the anterior part. What do you think will be the posterior part? What could be present here? What could be present here? I've just drawn that for you. What could be present here? Any guesses? Okay, there is inner table. And behind the inner table, what do we have? Yeah, okay. So you have some idea. Very good, guys. So we have brain. So brain, specifically, what is the part? It is a frontal lobe. Right. Very good. So there's another structure also. We'll write meninges, okay. When you learn brain, you will know what is meninges. So just I'm telling you, meninges is the covering of the brain. Okay. So we will tell it is meninges and the frontal lobe of brain. That forms the posterior relation. Anterior is by superciliary ridge. Then what forms the inferior aspect? Again, this one you are going to tell me what forms the inferior aspect of the frontal sinus. I'm marking that in green. You will tell me these are parts of external nose. Okay. I've given a clue for you, so you need to tell it yourself. What is this part called as in the external nose? You're going to tell me, just think and guess it. What do you think is found below the frontal air sinus? Yeah, very good. So that part is called the roof of nose. Okay. Right. So roof of nose is one inferior relation. The other inferior relation is, look at this diagram. This first diagram, what do you see here? That part has been marked as ethmoidal air cells. Okay. So that is also an inferior relation of the frontal sinus. Okay. So these are the two important inferior relations. Now that's about the frontal sinus. So we have anterior relation, posterior relation, inferior relation. So that is a triangular structure. Frontal air sinus is a triangular structure. Now let us see the relations of the ethmoidal. Okay, second we'll see about the sphenoidal air sinus. Okay, sphenoidal air sinus. Where do you see we have just we have that structure only in this diagram. Okay, someone has said cribriform plate for the inferior relation. Actually, cribriform plate, if you can very well focus on the diagram, see cribriform plate is not immediately found below the frontal sinus. I'll just show that. I'm marking that in blue color. So this is the posterior aspect. Okay, it's not directly related with the frontal sinus. Okay, so it's a part of the bone present on posterior inferior aspect, not actually inferior, from the posterior aspect. So it doesn't form the inferior relation. Okay, now let's see about the sphenoidal air sinus. So where do we have the sphenoidal air sinus? This cavity. So for this, what are the relations we should be saying? So we have superior, inferior, lateral, posterior, and anterior. Okay, so just showing it here. We have many relations for this sphenoidal air sinus. Superiorly, what do we have? Inferiorly, what do we have? Then lateral, then posterior and anterior. Okay, so we have 5 relations. We'll appreciate some relations in this diagram. So this is the sphenoidal sinus. Okay. Again, this is actually a cut section in the longitudinal manner. Okay, so what you see is the sphenoidal sinus. Just try to correlate with the diagram we saw previously. What is the superior relation? As you can appreciate with the parts marked in the diagram, you just tell it yourself. What is the superior part? Formed by pituitary. Okay, superior relation is formed by pituitary. Okay, and we are also appreciating the lateral relation. So what's the lateral relation? Internal carotid artery, cavernous sinus. Yes. So we have appreciated 2 important relations: the superior relation, the pituitary, and the lateral relation. We have carotid, internal carotid artery, and the cavernous sinus. Okay, this big blue color, it is cavernous sinus. Right. So we have completed 2 relations. Still 3 more left. We have finished off the superior relation. Yes. Then we have finished off the lateral relation, cavernous sinus and the internal carotid artery. Now we need to see the inferior, posterior, and anterior relation. So first, inferior relation, this you can imagine by yourself. Let me show that also. Here below this blue color highlighted area, that is below the sphenoidal sinus, there will be pharynx. Okay, pharynx is superior part is the nasopharynx. Okay, nasopharynx is what is found immediately behind the nasal cavity. I showed that to you in the beginning. Okay, so below the sphenoidal sinus, we will be having the nasopharynx. So we have completed the inferior relation also. The other two relations you can imagine by yourself, like how you said frontal lobe is found behind the frontal lobe is found behind the frontal sinus. Behind the sphenoidal sinus, we have pons and medulla oblongata. So that's the posterior relation. And anterior relation, sphenoethmoidal recess. Now, there is one question for you. Where do we find the sphenoethmoidal recess? I mentioned this to you before when we talked about the lateral wall of the nose. Where is the sphenoethmoidal recess found? Or I can give you a clue, it's found above some concha. Above which concha do we find sphenoethmoidal recess? So the next structure that we are going to see, the next relation is about the maxillary sinus. Maxillary sinus, we have 6 relations here. So first, roof, floor, okay, top, bottom. And we are also going to see another relation called base, apex, okay, and then anterior and posterior. So roof of maxillary sinus. Where is maxillary sinus? The biggest sinus, okay, it's the largest sinus. It is the sinus which is more prone for infections. If you can remember the case I mentioned you, the case had the diagnosis as acute maxillary sinusitis. So this is that maxillary sinus which was inflamed in that case. Okay, this is the biggest sinus. So what is found superior? Okay, on the roof we have the floor of the orbit. As I'm telling you the name, just have a look at the diagram, then only you can remember it again. The roof is formed by base of the orbit. The floor is formed by alveolar process of, right, I think I can show you both the boxes together so that you can see both of them. Floor is formed by alveolar process of maxilla. I think you can remember where the maxilla is found. So the alveolar process of maxilla is what forms the floor, right? And then the base is formed by the lateral wall of the nose. Lateral wall of the nose. This pink color is the lateral wall of the nose. So that's the base. And the apex is formed by the zygomatic process. Okay. Here is the zygomatic process. What is zygomatic process? Zygomatic bone is the cheekbone. Okay. I'm showing that in blue color here. So this is going to be the apex. And what is left out? We have to see the anterior and the posterior relations. Anterior is formed by maxilla. It is also formed by maxilla, the big bone. Okay. Anterior is formed by the body of maxilla, the anterior surface of body. And posterior is formed by the infratemporal surface. Okay, now if you want to understand that, you should definitely be knowing about maxilla bone. So for now, just remember anterior relation is formed by anterior surface of body of maxilla, and posterior is formed by maxilla's infratemporal surface. Okay, so in most of your books, there will not be any relation given for ethmoidal sinus. So just know about it. We can mention the roof and the lateral relation. So where is the ethmoidal sinus? It is the only sinus which is having anterior posterior divisions and also it's found in groups. So this region is the ethmoidal air sinus. So as a roof, what do we have? Orbital plate of the frontal bone. This big bone is the frontal bone that has an orbital plate, okay, that forms the roof. And on the lateral aspect, we have a bone called lamina papyracea. Okay. So the session will go very long if we discuss about the bones osteology. So just know the names, and later you can have a look at the osteology of these bones in your book. Just have a look at some atlas. That will give you a better picture. Okay. Now let us see the importance of the paranasal air sinus. Okay. We are telling paranasal air sinus again and again. Why is it so important? Right. One thing you can say, the possibility of sinusitis. Okay, that's a condition which is very painful. So that is one reason, right? But basically, what is the function of paranasal air sinus? I've listed that out here. The first function is air conditioning. Okay, its function is air conditioning. So air conditioning means, you know what an air conditioner does. It cools down the body. So similarly, when the nasal cavity is getting warm, or the temperature is getting altered in the nasal cavity, the paranasal air sinus will help in the regulation of temperature, so that the brain doesn't get affected and the visual structures in the skull doesn't get affected. Okay. The other function is resonance to voice. So when we speak, the resonance or the echoing effect that is given is also a function of paranasal air sinus. You can very well appreciate the reason, because when you are in a hollow room, your voice gets echoed. Similarly, this is a hollow cavity, so it echoes the voice, right? Then the third function is it lightens the weight of the skull bones. So we know birds have light weight because their bones are hollow. Similarly, these are hollow cavities, so they help in lightening the skull bones. Then the local immunity against the microbes. How is this possible? Whenever some infection gets inside, or whenever some foreign body like a microbe gets inside, there is an irritation sensed in the nasal cavity, and to wipe off the microbe or body in the sinuses, there will be secretions. Okay, our body regulates these secretions. The secretion is by means of the epithelial lining in the sinus, so that secretion will help in the removal of the microbes. And the last function is the growth of the facial skeleton after birth. Okay, they indirectly help in the growth of facial skeleton, right? So now this is another important thing for you. The dimensions of the sinuses. You need to memorize these numbers, because once this has been asked in your 10-mark question as a subdivision, the measurements of the sinuses. Okay, so we have mentioned the numbers here. The numbers, this is a standard value, but there can be varied values given in different books, so you can follow that particular value which is followed by your college. Okay, so first, in the frontal sinus, how can we remember these numbers? 32, 24, 16. So first of all, what is this number? Vertical is vertical, that is height of the sinus. Then transverse is the width of the sinus, and the anteroposterior is the depth of the sinus. Okay, so just keep that order, and then you need to memorize the numbers. So this is 32, 24, 16. You can see this is the multiple of 8. Okay, so just as multiples of 8, you can remember this number. And sphenoidal alone we have mentioned in centimeters. So one thing, if you're keeping it in centimeter, keep it in centimeter. If you're keeping it in millimeter, memorize the same way, so that you don't get confused with those values, right? So these are things you need to memorize by yourselves. Okay, now now that we have an idea about the paranasal sinuses, we're going to end the session with just few questions. Have a look at this. This is an X-ray of a skull. Okay, so now I want you to name the parts that I'm going to mark here. Okay, so I'm just going to ask you the parts, and you will tell me what sinus is that. So first, okay, what is this sinus? Okay, what's the sinus number 1? 2 sinuses on the top. Okay, then you need to answer it. Okay, then what is this sinus? The orange color. Okay, what is the sinus? And we can appreciate one more sinus here. This is actually an X-ray AP view, that is anteroposterior view. Yeah, very good. So everybody has an idea. Okay. Now, what is this sinus? The biggest, the largest sinus, which is more prone for infections. This thing will be very helpful to you in practicals, because in practicals, when they give you an X-ray and to elicit the features about it, then you need to know all these sinuses. Okay, so very good. Okay, Now this is an AP view. We have left one sinus alone, so that can be appreciated only in a lateral view of the skull. Okay, lateral X-ray. So actually, how do you call an X-ray? I mean, how do you actually express an X-ray? Okay, now mark this part. What is this? This is the fourth sinus. Okay, so whenever we get an X-ray, we should say that it is a plain X-ray. You should say the view anteroposterior or posterior-anterior. So these are all the first one which I showed you is anteroposterior. This is lateral view. So this is a plain X-ray lateral view of the skull. Okay, so very good. So that's the sphenoidal sinus, the deeper sinus. Right. So if you have any doubts, you can put in the comments, and I'll try to reply all of them. And here we'll have a look at the questions for exams. Okay, so these are the important questions. So paranasal air sinus is a very important repeated question in the short note. Okay, so you will need to write the relations, the openings, and we'll have to tell about the boundaries. That's the relation, and we'll also need to mention the measurements. Okay, then middle meatus. See, middle meatus, I'll just show you the diagram. We talked about the openings, right? In the middle meatus, we have so many openings. So that is also an important repeated short note. The medial wall and the lateral wall have been dealt in detail in a different video, so that will be posted soon. You can see that video for the medial and lateral wall. Okay. Now, this is the diagram which you need to practice for the middle meatus, okay, or even for the lateral wall when it's asked in a short note. Okay, here this diagram very clearly shows you all the openings. Okay, this is given in Vishram Singh, and you can practice that. All right, guys, thank you so much. And if you have any doubts, ask in the comment section, or you can ask in the webinar WhatsApp group. So yeah, thank you.